Welcome to Tracheostomy Care. My name is Chad Govey. I'm a respiratory care practitioner here at Carl Broman Medical Center. We're going to be talking about cleaning these artificial airways. There's a few things you need to consider before we can get started. First, what kind of artificial airway do I have? Predominantly the manufacturer is Shiley. So you're going to see these mostly in our organizations. A surgically placed tracheostomy tube is often referred to as this is a size 8 LPC. That stands for low pressure cuff. And what that means is your inner cannula is going to be non-disposable. So you have to clean this. So it makes tracheostomy care a little bit more complex when you have an artificial airway with a non-disposable inner cannula, because you have two stages. First, cleaning the inner cannula. Second stage, cleaning the faceplate and site. Now, if you have a tracheostomy tube that is placed percutaneously at the bedside, it's often referred to as a PERC. The inner cannula is disposable, which is kind of nice because stage 1 is just removing this, putting a sterile one in, and then cleaning the faceplate and site, stage 2. Shiley picked up on that and said, hey, that's a pretty good idea. So their newest model is called the Flex series. This is a clear faceplate, so you can see the stoma behind it. It's actually a little bit flexible as opposed to a super hard plastic, and it has a disposable inner cannula. So tracheostomy care is pretty slick, very quick. And we're going to go through both kinds of tracheostomy care, but we're going to start with the inner cannula that you have to clean. I'm going to ask that you bear with me because it's just me and my camera here. I'm going to make a little adjustment. I hope that works. Okay. Here's our tracheostomy tube. Maybe I'll bring you in just a little bit closer. Okay. First thing you're going to need is a tracheostomy care kit. This is going to contain all of the stuff we need, and you're going to need some sterile water. First thing I'm going to do, I'm going to get some gloves on. Let's go ahead and start opening all of our things. And what you're going to notice in this kit is I have sterile gloves in there all ready to go, which is nice. I'm going to go ahead and open up my water. And I'm going to go ahead and get rid of these gloves. And we're going to put on the sterile gloves so that we can remove all of the contents of the tracheostomy care kit. We start with your dominant hand, just touching the inside of the glove. Okay, got that one on. Now you can use this glove to go underneath the cuff and assist getting it on the left hand. Okay, let's go ahead and remove the contents of your tracheostomy care kit. This is a drape and this is going to be handy. I'm going to open this up and set it to the side because I'm going to pull the contents of the kit out and lay it on that area. Some of these things we don't need. These are old school trach care or tracheostomy ties, and we don't use those. Here, these are pipe cleaners. Some facilities may use them. We do not. This is the brush. This is critical. Definitely need this. Cotton swabs, critical. Definitely going to need this. Comes with 2. Tweezers, most definitely going to need this. Your dressing, definitely going to need this. And you've got a stack of 4x4s. We're going to use these guys. But these are dry, and what we're going to do is I'm going to break sterile field just for a second so that I can show you what I'm doing. In this trach care kit, there are a series of bins. This front bin, I'm going to stick the 4x4s in because I'm going to pour sterile water directly on those, and that's going to help me clean my faceplate. I'm going to remove these bins and set them to the side. See that right here? I have 2 stages. And now is the point in time in which one hand is going to become unsterile. So I need to decide which hand is going to stay sterile. And I usually use my dominant hand and I make a fist. So remind me to not to touch anything except for things that are sterile. Okay, I'm going to take my soon-to-be dirty hand and I'm going to remove the inner cannula. Actually, before I do that, I'm going to go ahead and put some water in the bins with my dirty hand and get ready. So I'm going to dump some water in there, dump some water on my 4x4s, dump some water in my secondary bin, because this is what we're going to do to rinse the inner cannula. Now, I'm going to use my pinky and my thumb to put a little bit of pressure on the faceplate, so when you go to unsnap this, the tracheostomy doesn't move too much in the airway, because it's going to cause people to cough and it's irritating. So I'm just going to put some pressure on here, gently remove this, and I'm going to drop this in the first bin. I'm going to take that same hand and grab the brush, but I'm just going to touch this back loop. So it's not going to get even close to the tracheostomy inner cannula. With my sterile hand, I'm going to grab this inner cannula and I'm going to run this brush. There. Take this, rinse, and then final rinse in that secondary bin. And this with my sterile hand. The only thing my non-sterile hand was doing was touching this back side of this loop right here. Didn't come close to the airway. Okay, now we're getting ready to put this back with my sterile hand and gently snap. Okay, sterile hand, gauze. We got this wet with sterile water. What I'm going to do is make large swipes here on the faceplate. One direction, boom. One direction above, boom. One direction below, and one direction here. Cotton swabs. I'm going to dip this in the basin that I had my 4x4s in, and I'm going to go below, just below the faceplate. One swipe, one direction. Same with the other cotton swab. One swipe above, just below the faceplate. So now my faceplate is clean. This is the final step. It's putting this dressing. And how do I get that underneath this tracheostomy tube? Well, that's where these guys come in. And so it's a little bit tricky, but you just use this to kind of tuck, and you finagle your way and get this guy underneath there. And it can be done. If it seems like it's too snug, you can loosen your Velcro trach ties. And that is going to be trach care for the non-disposable inner cannula. Now, real quick, we'll just have some talking points here about what about the tracheostomy tube with the disposable inner cannula? What do I need? So let's just take a quick look at that. Let me strap him up here. Okay, so what you're going to need is sterile water. You're going to need, you don't necessarily need a whole trach care kit. That's the point. Because you're going to have a lot of waste. All you're going to need is 4x4s, some cotton tip swabs, an inner cannula, and some sterile water. Because And you're still going to be sterile though. So what you're going to do is open everything up. You're going to open your inner cannula up. You're going to put your sterile gloves on. This is going to be my sterile hand. With my dirty hand, I'm going to remove the inner cannula, dispose of it, and grab the new inner cannula with my sterile hand and snap him in. Now I'm halfway done. I'm going to grab 4x4s. I'm going to get him wet with sterile water, and I'm going to run the faceplate. Right, wipe the faceplate. I'm going to get my cotton tip swabs. I'm going to get it wet, sterile water. Underneath, one swipe. Underneath, or above, rather. And then you're going to need the split dressing. So there's a couple different ways to approach this. Can you open a trach care kit and get a bunch of supplies that has pretty much everything you need? Of course. Of course. But once you do this a couple times, you're going to find that you don't need all of that stuff whenever you have a tracheostomy tube that has a disposable inner cannula. You just need a couple things just to clean the site. So it's not near as complex. And that, my friends, is tracheostomy care. Until next time, take care.